Hello, my name is Megan. I will be the voice behind our presentation on cultural competency and inequities based on disability. Along with myself, the other group members are Iman, Karina, Jessica, and Fidelia. During this presentation, we will first go over what cultural competence is, followed by some examples of cultural competence. We will then cover how the ADA defines what a disability is. And then we will cover inequities based on disability status and ways to combat those inequities. And lastly, we will cover why cultural competency is important. So what is cultural competency? Cultural competency is being aware of your own cultural attitudes and belief systems and how they're going to differ from the unique needs, values, and experiences of other people. So just recognizing that your beliefs are not going to be the same across cultures. And I think this kind of develops naturally in people who have meaningful relationships with people from various cultural backgrounds. A little more on cultural competency. It includes intersecting identities. So not just one's culture, but also their sexual orientation, their immigration status, their race, ethnicity, age, and education. It should also be noted that cultural competency has a direct effect on someone's health and behavior, as you will see in our next slide. On this slide, we give some examples of cultural competence in healthcare. So, for example, language and communication barriers can have a direct impact on the quality of the visit and health outcomes. If the physician is struggling to understand the patient and why they're there, that's obviously going to change how the doctor can treat them. And the other way is true as well. If the patient cannot understand the physician and follow their orders, that's going to impact their health outcomes. So cultural competence in healthcare can be as simple as providing interpreter services, recruiting and retaining minority staff that's bilingual and bicultural, and then also the use of community health workers. So people within a community feel that they have representation by somebody that lives in their own community. So how can you be more culturally competent? So we have a few examples. If you work in healthcare, respecting a patient's beliefs and religious background, and simply empathizing with them. Also, being aware of your own personal worldviews and how that colors the decisions that you make and the way that you treat other people. And our final example is to develop skills that help you communicate and interact with people from across various cultures. What is a disability? So we are using the ADA's definition, and they define a person with a disability as someone who has a physical or mental impairment that substantially limits one or more major life activities, has a history or record of such an impairment, and is perceived by others as having such an impairment. People with disabilities experience health inequities, especially when another intersecting disadvantage exists, as we discussed on a previous slide. So if you remember, some examples of those are age, sexual orientation or identity, gender, or education. For example, pre-existing disparities among disabled individuals places them at higher risk of contracting COVID, and then when they do get it, they're also at greater risk of severe illness. This is further exacerbated by limited risk assessment and protective measures due to a lack of data related to COVID infection in the disabled population in terms of testing, infection, and outcomes. Another example of inequities based on disability status would be how the pandemic increased unemployment and economic insecurity for people with disabilities, further worsening health disparities. For example, Employers might refuse an employee's request to work from home to accommodate a medical condition that increases their risk of COVID if the employer has already instituted protective measures to prevent the spread of COVID. And lastly, it should be noted that in rare situations, businesses are not required to follow ADA recommendations. So this relates to small businesses with employers or with fewer than 15 employees. We know that health inequities exist. So how do we improve them? One way is through cross-sector collaboration that involves both the private and public sectors, as well as multiple government agencies. For example, the education department and land developers both have an impact on how communities are built. Their choices can either improve or worsen health disparities within the disabled community. Anytime you're involved in policymaking, ask yourself, how can this project be developed to support and improve the social determinants of health for people with disabilities? So one way we can combat and improve inequities in the school system is to create policies that standardize approaches to identifying and supporting students with disabilities. Because intersectionality exacerbates inequities, schools and policymakers should pay extra attention to students with multiple disadvantages. Least restrictive environment programs are programs in school systems that are designed to combat educational inequities by ensuring kids with disabilities learn alongside their non-disabled peers while still receiving a specialized education. This type of environment promotes inclusion and allows all students, disabled or not, to be included in their community. In addition to ensuring we have supports in place for students with disabilities, we need to create and modify neighborhoods to accommodate users with disabilities. Being able to freely move about your community is critical for work, play, worship, and to access healthcare. By now, you're probably starting to see why cultural competence is so important to creating a community where everyone can reach their full potential. Understanding the unique cultural experiences of people with disabilities allows for public health officials to create and share information in a way that is sensitive and accessible to people with disabilities, those who care for them, and those who make policies affecting them. 40% of Kansas residents with disabilities felt that their health was fair or poor, while only 11% of the general population viewed their health in this way. It is important to be aware of cultural values and beliefs so that you can ensure that public health content is communicated in a way that is meaningful to the disability community, regardless of their cultural background, so everyone has the same access to and use of public health information. The importance of cultural competence is further supported by the 1999 Olmsted ruling, where the Supreme Court ruled that segregating individuals with disabilities, particularly through unjust institutionalization, was against the Americans with Disabilities Act. The ruling reinforces the importance of cultural competence by ensuring support services respect the rights of people with disabilities and encourages them to be an active member of their community, including their own cultural and religious practices. So a quick summary of our presentation. We started with defining what cultural competency is. We define that as the ability to be aware of your own cultural attitudes and how they differ across various cultures. We included intersecting identities. We gave some examples of cultural competence in healthcare, and also ways to be more culturally competent. We answered the question, what is a disability? And we used the ADA definition. And then we gave some inequities based on disability status, using COVID as an example, and how that affected individuals with disabilities in the workplace. We gave some ways to combat inequities through policymaking, also some ways to combat inequities in the school system, including least restrictive environment programs. We gave examples of combating inequities in the neighborhoods. And then we went on to discuss the importance of cultural competence. And we talked about the Olmsted ruling and how that ruling reinforces the importance of cultural competence. And that was it. And that brings us to the end of our presentation. We hope you enjoyed it. And here is our final slide with all of the references that we used to put together this PowerPoint.